Here we go. Nice to see you. Thanks for joining us. Dr. Erickson, EHS Physical Therapy, Chiropractic, your herniated disc expert, the herniated disc fix program creator, along with.
Yeah, Dr. Jake Anderson here with Essential Motion Spine and Sport.
So we want to talk about some commonly seen, commonly heard, commonly discussed terms that people will see in an advanced image. This could be an MRI, it could be a CT, it could be an X-ray. So just kind of go through the top, and now they're different, but a lot of them are scary sounding. But they're a lot of times, for most of these, they're very normal. They're very
Expected?
yeah. So what we'd call unremarkable. It's just what happens.
Yeah. So a lot of the common ones we hear here are these are the five. I'm just going to list them off, and then we'll kind of dive into each one. So we've got DDD, Degenerative Disc Disease. We also have DJD, Degenerative Joint Disease. We have Facet Arthropathy, Stenosis, and Hypertrophy. Mm-hmm. So all these are just bony changes that we see on an image, right? Mm-hmm. And that does not necessarily mean that if we have these things, we're going to have pain or we're going to be limited in any way. So the first one here, let's just go with the first two because they kind of go hand in hand. Yeah. So a lot of people are told after they get imaging, right? Oh, you have degenerative disc disease, and people like to latch onto that, and they say, "Oh, don't you know I have degenerative discs?" That's 100% why my back hurts. Thinking in your head,
like my disc is like, I almost can picture it in my mind of like it's actively like degenerating away and like, shrinking down and like dissolving, disintegrating into nothingness. Yeah. Which is not necessarily the case of what I mean. It's scary words to say you have degenerating, disc, and then you call it a disease. That makes it feel like it's very
limiting.
Yeah, and quickly progressive, and like, oh my gosh, this is a really big deal. I'm gonna lose my, discs in my back.
So a good analogy I heard is that, when people age, right? We get wrinkles, we get gray hair, we have to start wearing glasses. People don't think twice about that. But as soon as they have an image of their spine and they have degenerative discs, then it matters. Yeah. So
it's always there.
Yeah, it's always there.
It's a natural part of aging.
So these things can be thought of as like expected, normal changes that will come with age. I mean, you've earned them over time. That's how they happen. They're nothing super concerning.
You're losing a bit of disc height, so it's not quite as hydrophilic as it was. It doesn't have quite as much water uptake. It's not as plump. It's not as full. It starts to get little cracks, little fissures, just like our skin, like wrinkles as we age. It's just a natural part of the aging process, saying that the disc itself is starting to kind of, shrink down a bit, get a little bit harder, a little more dense. It's not as dynamic, movable, squishy as it was.
Yeah. Okay, next one here, we got Facet Arthropathy.
The only difference here in the joint just means that just has to do with the joint itself around. So the disc is between the joint. So you can have some different osteophytes, which bone means like growth. Just like some bone spurring. That's the whole like joint itself as it moves around. There can be, again, some just degenerative, or think like arthritic, aging processes. Yeah.
The next one, Facet Arthropathy. That arth part, everyone always associates with like arthritis, which I guess in a way it kind of is. It really means joint. It's just age-related changes to the back of the joint. Mm-hmm. So the joints of your spine, when those become irritated, or you just get bony changes, so you can get some growth on them. That's what facet arthropathy is. It's nothing like life-threatening. It doesn't mean you're going to live with back pain forever. It's just a change we see on imaging.
Well, and the facet joints themselves are just they're specifically named little parts of the whole like vertebral or lumbar spine segment. Yeah. So they just kind of are. It's where the movement occurs. So in the lumbar spine, they're kind of more vertically centered, oriented. And then as you bend forward, they slide on each other this way. As you bend backward, they slide this way. As I turn or bend, one side opens, one side closes. So that's just that movement. So arthropathy and even hypertrophy can go kind of...
They can go together.
Together on the facets. It just means that there's like hyper means
an increase
growth. So there's just some increased bone growth due to bone spurs and just some arthritic changes.
Another good one is stenosis. Pretty much everyone is familiar with spinal stenosis. So stenosis is just a fancy word that means narrowing of a space. Usually it's the like central canal of the spine, and then we have the lateral recesses. So we see a lot of people questioning their image findings where it says like lateral recess stenosis. So that just means the space like where the nerve root comes out.
There's a little hole.
Yep, perfect. Yeah, that space
that hole is
narrows, and that can press upon a nerve nerves don't like to be pressed and they don't like to be stretched. So that can cause some of that sciatica symptoms, or like the classic stenosis signs where you get the like numbness and tingling down the leg.
But you could also have a stenosis present, meaning that the hole that was once one size is now a little bit smaller, and not have it actually bother the nerve. I mean, there's still enough room for the nerve to move through, and just because it's present doesn't mean that it's necessarily the cause of the pain. It just shows that the hole that was once this big is now this big. There still could be enough room for that nerve to slide through and not be compressed. And it could be a combination of the slightly reduced size of the foramen, which is the hole, maybe in conjunction with another soft tissue thing being in the way, like a little piece of the disc. And now all of a sudden, there's not enough room because there's two things in the way.
You can also functionally change that. And what I mean by that is like the classic thing we see in like lumbar stenosis is the shopping cart sign where the person walks like all hunched over. The reason is it opens up those joints in the low back and creates more room. Another way we could do that is to rock the hips back into like a posterior tilt. That's going to open those joints up, move more through the thoracic spine, the mid back, and that takes a little bit of that pressure off the low back, so you can just manipulate or adapt the way you move to accommodate that narrowed space. So it's not,
and it will be very consistent. So the way we would assess it is, ask you a bunch of questions. Obviously, what makes you better, what makes you worse, test some things out objectively. But a true stenosis pain, because it's a bone, it cannot be changed. I can't make, Jake and I can't make the hole bigger. So it'll be very consistent. Every time you do a certain movement or sustained position or posture, it will reproduce that symptom. Now, if we can change it fairly rapidly to where it's not bothering you so bad, I could, before I could only walk a certain amount of time, a block, and now I can go, and some days I can go 2 miles, some days I can't hardly get out of the chair. That can't be a stenosis. The bone doesn't just all of a sudden poof grow into place and then poof it's gone. It doesn't grow that fast. It's got to be, it's a different presentation, but we'll help you figure that out.
Yeah. So if you have any of these issues, they may not be directly correlated to why you're having pain, but even if they are playing a role, we can still help you. So if you guys have questions on any of that, ask questions below. If you have imaging findings that you want to know explanations for what those terms mean, if there's a word you don't recognize, we'd be happy to comment.
If we missed some here, there are more than this,
some of
but
the common ones.
We hope this helped explain some of the commonly, misunderstood or the questions that, I see all these words, I don't know what they mean, it's scary, what do I have going on? But many of these are on there, and many of the time, they're just normal findings. What they're really looking for is the
flags,
sinister,
tumors,
presence of other,
infections.
big time bone, like like I said, compression fractures, wedge fractures, tumors.
Bony diseases.
Big time problems where things are not right. So these are very normal.
So keep on keeping on. We'll see you on the next one.